Late last night at about 2 or 3 this morning, we were asked to bring some individuals here, individuals who had either tested positive or had a high likelihood of testing positive because of symptoms they were exhibiting. These individuals were brought here because we have the personnel, we have the facilities, we have the resources and the expertise to handle these kind of individuals. This morning we did have 13 individuals who arrived on the 2 planes. They were transported here to the medical center where they were being assessed and cared for.
And I was a part of the team that boarded the planes, did the initial assessment of the patients arriving from Japan. And at that time, everyone appeared to have arrived comfortably. One patient was transported to the hospital, to the biocontainment unit, because of a chronic condition and had some lightheadedness, had a mild cough, had a fever that was documented before landing, and also had a chronic condition which could complicate the issue if he were to test positive for coronavirus. And so as a precautionary measure, he was transported to the biocontainment unit for testing and also for observation to make sure his condition was stable and not deteriorating.
We have practiced and trained for this. We actually train others across the U.S. and internationally to do clinical care as well as infection prevention and control techniques to keep ourselves safe and the individuals safe. So the folks that are over in the quarantine center have all been now tested, and so we're waiting for those results. Anything prior to this, like we've got no documented information, it's all been verbal, and so that's why we're going through and doing the additional testing of everyone at this time.
What we're able to do is because we do have a CDC approved test, so we can very rapidly assess the individuals, we can conduct the test, and similar to the individual who came from Camp Ashland the other day who had some symptoms, they came to campus, we did the test, it was repeated negative and they were able to go back. We're using that same test on these individuals. Regardless of whether they test positive or negative on the test conducted today, will be here for 14 days. Those that test positive and are ill could theoretically be here longer than 14 days. With the biocontainment unit being launched 15 years ago, since that time we've continued to develop expertise, develop the skills, and do exercises to prepare for times like this. With our federal quarantine center, which recently opened in the Davis Global Center, we now have 20 purpose-built rooms built in collaboration with the federal government in a public-private partnership to prepare for a quarantine mission just like this. So when we received the notification early this morning requesting that we assist the Assistant Secretary for Preparedness Response, the State Department, CDC, we were ready, willing, and able to step up and take that on.
They were very tired after the long travel, but their spirits were high. They were very grateful. Once they got on the buses and they're on their way here, we're talking with each other and with us, and we're very, I think, very upbeat and glad to be here.
I would say a sense of relief. I think they were relieved to be here. I think they felt comfortable. They saw, our teams arrive, and I think we were Nebraska nice and friendly, but also we were confident we could care for them.